Hi, I'm Dr. Mike Weiner from Optimal Spine and Body. I practice a very different type of chiropractic called chiropractic biophysics. And I'm also located in Alpharetta, Georgia. So I want to talk today about chronic low back pain, especially when herniated discs are involved. What does that mean? That is the cushion in between the spine that if you have damage to that disc, it can, one, either bulge out and either press on the nerves, but more commonly, which really isn't discussed, is that there's nerves that go to the disc. And when the disc gets damaged, it will then send the nerves, it will stimulate them to cause pain signals, which can feel like sciatica, dull pain coming across all the way throughout the lower back. Chronic pain doesn't get better by itself. You try all these treatments, gets better, but then it comes back. You get it also, maybe you get a steroid injection. Gets better, but then the pain comes back. So is pain really the problem? Something else must be it. And that's why I find that the disc in itself is a pain generator, which causes people to constantly have that, and it's really frustrating, and it's really annoying, and it just holds people back. Where other people may not see it, but they know that themselves, that they have it, it's holding them back from doing things that they love. So that's why I have a huge passion for helping that. Let me show you how I can help that, and also what I do here helps when other people or other practitioners really haven't helped them before. So I have over here, it's called a Deneral table. It is designed to correct spines very specifically. I do a very specific traction. It's not just a general traction that just pulls like this. That's very non-specific and also sometimes contraindicated, which means you shouldn't be getting it. In order to get the best treatment, you got to analyze first, you got to take x-rays, and that's why I do that. And that's why patients get so much better. So I'm going to use Farah for an example of how I help people with chronic low back pain, herniated discs, and disc issues that are causing other issues as well in the body, whether it's pain down the legs, numbness, tingling, and all the issues, weakness as well. All right, so let me show you. You can take a seat right here. And then I would have them, and you can lay back for me all the way. Okay, perfect. So I'm going to just lift this up so everyone can see. Okay, perfect. So you can see I have a pulley device here. If you want to correct the spine, you got to pull at the exact angle. And if someone doesn't have the exact angle, then how are they going to get you the exact results for you individually? So that's why I do what I do. So you can see over here, this is a pulley system. Depending on the area that needs to be corrected, I can change it. So let's say that you have a herniated disc in the lower segment, L5S1. It's very common. That means that you need to get traction that's lower. So I move it lower. And on top of that, I will then pull the spine really gently, in a really gentle position, always at first to make sure that it feels good. Because that's the first step. I'm able to pull in a very specific angle. Get over here. And I pull right there and I let him hold. And it feels good, right? Yeah, so the reason why it feels good, and I know with what Farah needs, is she needs more curve in the lower part of her spine. So what am I talking about? People that have chronic low back pain, disc issues, this is what I find. Other places are not really taking x-rays, number one. They're saying it's not necessary. I get very upset at that because these are the people that have been so many other places that didn't have x-rays and they weren't getting the treatment. I take x-rays, I find that their posture is contributing to all the problems that they're having. Also, on top of that, they may have reverse curves of their lower back. You're supposed to have a curve. They're having opposite curves. It's shifting backwards. And that, in general, puts more stress and strain on the discs, which then leads to chronic pain, which then leads to sciatica, which then leads to all these other issues, and then eventually people say, oh, you need surgery. If you don't believe that you need to have surgery, and you really believe that your body can actually heal by itself, that's what I do. And I use this piece of equipment, and this is why it helps other people, that they don't avoid surgery. Also, just live the life they want to live. You don't have to have pain to have a problem. And then in addition to that, nerves in the lower part of the back, they go to the organs of the pelvis. What I find, people with digestive issues also have chronic low back pain, or vice versa, or even if not have pain, have digestive issues. It starts to improve. As the spine aligns, now large intestines improve. Constipation, diarrhea, irritable bowel syndrome. The bladder, nerves go to the low back, go to the bladder. I also find that people have frequent urination. They wake up at night, use the restroom. That improves. And even sexual dysfunction as well, whether it's with females that have irregular cycles, painful cycles, cramping. That improves because the nerves in the lower back go to the sexual organs. And then on top of that, with men, decreased libido or even sexual dysfunction of any type. Instead of then having to have Viagra or other types of drugs, a lot of patients then find, because the nerves are functioning better, it also helps with that as well. So you don't have to suffer. You can live the life you want to live. And if you want this, and you want to live a better life, and you don't want to have to do pain meds, you don't want to have to do all these other treatments that just aren't working, then I would love to help. So anyone that sees this video, call the office. You can follow the link to www.optimalspineandbody.com. You can read more. You can sign up for appointments. Just use the word or say the word optimal. That will let us know that you saw this video, that you're an educated type of patient, and because of that, I'll do a free consult on me to see if I can help you.